Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le Premier ministre, l'honorable Blaine Higgs, et le médecin hygiéniste en chef, Dr. Jennifer Russell. Speaking on behalf of the province today are the Honorable Blaine Higgs, Premier of New Brunswick, and Dr. Jennifer Russell, the province's Chief Medical Officer of Health. Premier Higgs.
Good afternoon. Bonjour. Our hearts are with the people of Nova Scotia today as we all try to process the tragic events of this past weekend that left so many families grieving and many others injured from a senseless act of violence. Je sais que tous les gens de Nouveau-Brunswick s'y joignent à moi pour offrir nos plus sincères condoléances à notre province voisine, ainsi qu'aux amis et à la famille de toutes les personnes touchées. La Nouvelle-Écosse et le Nouveau-Brunswick sont étroitement liés. Many of you have loved ones in the province. We are much more than neighbors, and today and in the days to come, we grieve with all Nova Scotians. I have been in contact with Premier McNeil and have offered our sympathies and support. As well, flags have been lowered to half-mast at the Legislative Assembly and across the province in honor of those lost. A tragic event like this shines a spotlight on the courage and sacrifices of our frontline workers and first responders. The RCMP lost one of their own over the weekend, Constable Heidi Stevenson. As well, another officer was injured. Our thoughts are with them and their families, as well as each and every person lost in this senseless tragedy. Malgré les défis reliés à la COVID-19 et des tragédies comme celle de la fin de semaine, nos policiers continuent de sauver et de protéger nos communautés. The names of the other victims will be released in the coming days. They will all be mourned, as each loss is profound. At times like this, we want together, close with people we love, to see firsthand that everyone is safe. Unfortunately, many families are apart right now as we work to contain the spread of COVID-19. Je vous encourage à prendre des nouvelles de vos proches, en ligne et par téléphone, et de trouver des façons de garder le contact même si vous êtes éloigné physiquement. Les défis auxquels nous faisons face maintenant, y compris la nécessité d'être séparés, ne vont pas durer toujours. It is especially hard right now, but we will get through this. In light of what's happened in our neighboring province, I will end today simply by saying our thoughts and prayers are with all of you. Dr. Russell will now give the COVID-19 update. Thank you. Merci.
Good afternoon. Bon après-midi à vous tous. Aujourd'hui, c'est une journée très difficile, pleine de tristesse, pleine de peine. Alors, avant de commencer aujourd'hui, je tiens à joindre ma voix à celle du Premier ministre et de tous les citoyens du Nouveau-Brunswick pour offrir mes sincères condoléances aux gens de la Nouvelle-Écosse à la suite des événements insensés et tragiques qui se sont produits en fin de semaine. Tous les Néo-Brunswickois sont à votre côté et partagent votre peine et votre chagrin. Les mots ne suffisent pas pour exprimer la tristesse que nous ressentons, nous aussi. Aujourd'hui, nous sommes tous des Néo-Écossais. I want to add my voice to that of the Premier and all other New Brunswickers in offering condolences to the people of Nova Scotia following this senseless and tragic events of this past weekend. All New Brunswickers stand with you in this time of sorrow and heartache, and words cannot adequately express the sadness that we share with you. Today, we are all Nova Scotians. The COVID-19 crisis has enabled us to tap into a deep well of resiliency. It has given us renewed confidence in facing the challenges that will crop up in our lives. This weekend's tragedy will even further test the people of Nova Scotia in these already difficult times. They need and deserve our support, and they will get it. Sharing pain is the theme of a poem called Because We Love, We Cry by Sherry Fitch, an acclaimed children's author. You may know her. She is the sister of the former Chief of Police, Leanne Fitch, and I used to read her books to my kids when they were young. You might remember Mabel Merple and Toes in My Nose, and There Were Monkeys in My Kitchen. So she posted this on Facebook this morning, and I asked her if I could read it to you today, and she phoned me, and I spoke with her, and she said yes, and she would be very happy for me to do that. Because we love, we cry. Sometimes there is no sense to things, my child. Sometimes there is no answer to the questions why. Sometimes things beyond all understanding. Sometimes people die. When it hurts like this, my child, when you are scared, suffering, confused, even if we are not together, let us cry. Remember there is so much love, and because we love, we cry. Sometimes the sadness takes away your breath. Sometimes the pain seems endless, deep. Sometimes you cannot find the sun. Sometimes you wish you were asleep. When it hurts like this, my child, when you are scared, suffering, confused, even if we are not together let us cry. Remember, there is still so much love. Because we love, we cry. Pray that I had answers, child. Pray this wasn't so. There are impossible things, child, I cannot bear for you to know. When it hurts like this, my child, when you are scared, suffering, confused, even if we are not together let us cry. Yes, there is still so much love. Because we love, we cry. Thank you, Sherry Fitch. I urge every New Brunswicker to reach out to your family, friends, and colleagues in Nova Scotia today. Your kindness will help them bear the weight of the sadness they are now feeling. They need to know they are not alone and that their neighbors are here for them, just as you have been there for your family and your friends in New Brunswick through the current COVID-19 crisis. It is the very least that we can do, and it will mean so very much. Today I have further encouraging COVID-19 news to share with you. There are no new cases to report in New Brunswick. This is the 6th day in the last 10 when we have had no new cases to report. In the past week, there have been just 4 new cases of COVID-19 in New Brunswick. Of the 118 cases confirmed to date, 98 are now considered to have recovered. We still have 20 active cases in this province, and we still have people who are receiving intensive care in our hospitals, so please keep them in your thoughts. Aujourd'hui, je suis heureuse de vous annoncer d'autres nouvelles encourageantes concernant le COVID-19. Il n'y a aucun nouveau cas à signaler au Nouveau-Brunswick aujourd'hui. Il n'y a aucun nouveau cas à signaler pour la 6e fois au cours des 10 derniers jours. Au cours de la dernière semaine, seuls 4 nouveaux cas de COVID-19 ont été signalés au Nouveau-Brunswick. Des 118 cas signalés jusqu'à présent, 98 sont maintenant rétablis. Il y a encore 20 cas actifs dans la province. But in recent days, there has been a clear trend. Fewer new cases are being confirmed, and more people are recovering from their illness. And there is no doubt that this is good news, and we can all share in the success we have achieved to date. But make no mistake, this pandemic is not over, and in this province or anywhere else in the world, we must remain on guard and keep doing what has got us to this stage. That means continuing to stay home, in your own home, as much as you possibly can, keeping your interactions with others brief when you do go out, and it means maintaining 2 meters of physical distance from those you meet. Washing your hands regularly and thoroughly, cleaning thoroughly the frequently touched surfaces of your home, such as doorknobs and countertops. All of these actions are building and strengthening a barrier that the COVID-19 virus cannot cross. The virus cannot move very far on its own. It's people who move and thereby carry the disease to new hosts. To date, the vast majority of New Brunswickers have followed the advice of public health to limit their movements, and this has been crucial in our success as a province. So I really want everybody to understand the importance of what they have been doing and how much it has mattered and how much it has contributed to our success. And so this will be something that will become a recurring theme in all of our lives. And I need everybody to keep that in mind. I know we can't do that forever, and we live in a mobile society where people are accustomed to moving about for education, pleasure, and work. But it is a fact that of life today that many New Brunswickers and New Brunswick families depend on wage that is earned in another province. So many New Brunswickers regularly commute across the country to work in mines, forests, and oil fields in Western Canada. This pattern has been disrupted during the current state of emergency, but we will have to be vigilant to prevent the movement of workers from bringing the COVID-19 virus home with them. So, like all travelers, we expect everyone to continue following the rules around staying home for 14 days when you've traveled outside the province, and that is to protect the province from having any risk of contracting COVID-19. Recently, this has been highlighted by an outbreak that has emerged in Alberta at Carroll Lake north of Fort McMurray. So there have been a dozen cases of COVID-19 reported among workers at that site. So cases have then emerged as a result in British Columbia and Saskatchewan that have been traced back to the people who traveled after working at Carroll Lake. We know that if any New Brunswickers are now or have recently been at this work site, that the information around that has been slow to be transmitted to us. But if there are people who have traveled from that area, obviously anywhere outside of New Brunswick, everyone has to self-isolate for 14 days. It is very, very important. And if you develop symptoms, call 811. De nombreux citoyens de New Brunswick font régulièrement la navette d'un bout à l'autre du pays pour travailler dans les mines, les forêts, les champs de pétrole de l'ouest du Canada. L'état d'urgence que nous vivons présentement a perturbé cette routine. Nous devrons toutefois faire preuve de vigilance pour éviter que ces travailleurs apportent le virus responsable de la COVID-19 avec eux à la maison. Un exemple de cette possibilité s'est récemment produit sur le chantier de sable bitumineux à Carroll Lake, au nord de Fort McMurray, en Alberta. Au moins une douzaine de travailleurs de ce chantier ont contracté la COVID-19. Des cas signalés en Colombie-Britannique et en Saskatchewan ont été retracés à des travailleurs revenus à la maison après une période de travail à Carroll Lake. But I appeal to any New Brunswicker who has recently been outside the province, including Carroll Lake, or has been in direct contact with a person who has recently worked there to immediately self-isolate for 14 days, as per those travel instructions for all New Brunswickers traveling outside the province, and contact 811 for further instructions, especially if you develop symptoms. Even if you feel well and are showing no symptoms, please stay at home for 14 days if you've been outside the province. You can be carrying the virus with you and you can infect others. Until an effective vaccine or other treatment is widely available, we have to remain vigilant. And this pattern of having these types of measures in place and then eventually lifting them may become a recurring theme. And we have to get used to the idea that we may relax measures when numbers are low, and then we may have to re-administer them when numbers get high. So, je vous demande de continuer à faire preuve de patience et en prendre toutes les mesures possibles pour empêcher le virus de s'implanter encore plus dans notre province. Nous n'avons pas fini avec le COVID-19 et la COVID-19 n'en a pas fini avec nous non plus. I ask that you continue to be patient and that you continue to do all that you can to deny the virus any chance to take a firmer foothold in our province. We are not done with COVID-19, and COVID-19 is not done with us. Thank you very much.
Thank you, Dr. Russell. Premier Higgs, merci, Monsieur le Premier ministre et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We will now proceed with questions from the media. You have the right to pose your question in the language of your choice. Andrew Watt, Telegraph-Journal.
Thanks, Bruce. My question is to the Premier. Premier Higgs, first of all, can you share a bit more of your conversation with Premier McNeil about what happened in Nova Scotia on the weekend?
Well, Andrew, it wasn't a conversation as such. I connected with him in the morning, mid-morning, on Sunday morning in relation to what I was hearing and what I'd gotten report from my officials. And then we corresponded back and forth as a text message. I offered my obviously my condolences, and I offered any support that we could provide. And of course, I'm well aware that our officers, the RCMP particularly, were working hand in hand with the detachments in Nova Scotia, and we're working with the case together.
Thank you. Andrew, do you have a follow-up question today?
I do. Thank you, Bruce. Again, to the Premier. Premier, so last week you sort of talked about, if these good numbers, no new cases or very few cases trend continues, that you would be looking at potentially, at the start of May, maybe being an opening point. Your confidence must be growing, I'm assuming?
Well, certainly every day that has minimal cases or no cases is a great day in that sense. We will work continually with Dr. Russell and her team to ensure that any changes we make would reflect the ability for us to maintain the public health rules and regulations in order to make those changes. Yes, the fact that we are continuing to receive positive results would reinforce our idea to look at getting back to a new norm, whatever that will be, but it'll be different than what we're used to. Also looking at the economic recovery side, and then trying to balance this as we reintegrate into society. I, like everyone else in the province, is feeling a need to start to have a change, and I just want to say how appreciative I am of how the citizens of this province have reacted to follow the rules, to stay very focused on protecting each other, protecting their families, and working diligently for us to fight this on one front. And those efforts are certainly bearing positive results, and which ultimately we would hope would allow us to make some positive changes in the coming days and weeks as we had hoped.
Thank you. Vicki Hogarth, Charlotte County TV.
Thanks, Bruce. Question is for the Premier. I understand from speaking to local RCMP that mostly warnings are being given out for people who aren't social distancing, but the odd ticket is still being handed out for blatant non-compliance, such as cars full of friends. Can you provide us with the latest update on how many fines have been given out to individuals who aren't practicing social distancing?
Actually, I do not know the exact number. I think we had 26 of last week, and I can get an update on that and certainly provide that to you or have it for you tomorrow. But certainly our safety and compliance officers and our policemen are authorized to look for and question individuals that obviously are more than a family outing, but more of a social gathering in vehicles, because that is when we kind of let our guard down, the biggest opportunity or potential is that we quickly return to a normal way of life, that we're not really ready for that, and we won't be really ready for it as a normal way of life until we have a vaccine. So I can get you that exact number, but I do not have it today.
Thank you. Vicki, would you have a follow-up today?
I do. Thank you, Bruce. My follow-up for the Premier as well. It's been reported that there was a surge in gun and ammo sales in places like Macadam in March before the lockdown became seriously in effect. How do you respond to people who might be nervous about this fact in relation to the tragedy this past weekend?
Well, I can't certainly confirm any resurgence. That has not been reported to me that has been a reality or not. So, and I guess what I would say is that according to the reports that I've received on this tragic event in Nova Scotia, and it was reported, certainly yesterday by the police officials in charge, that this was an event that was some time in the planning. Because of certainly, obviously the car that was marked up was brought into the as an example that this was not happened because of any recent situation in relation to COVID, but more so in a planned event that was, I guess, pending.
Thank you, Premier.
Thank you. Gail Harding, CBC.
This is for Premier Higgs. A lot of surgeries were canceled to prepare for the onslaught of COVID-19 cases, but only 13 people have been admitted to the hospitals for COVID. Why couldn't some of the more serious surgeries or surgeries that would relieve some people of great pain have continued, even if it was at a reduced rate?
Well, I think initially, and Dr. Russell may want to speak to this as well, initially the plan, and as we were working with the public health, was to make sure that we had adequate capability within our hospitals. And so it's too late to wait for that. You need to make sure that you're ready to deal with what we were seeing from other countries, other provinces. And so, you know, while it is wonderful news that we haven't seen the COVID outbreak here, like as many of our neighbors and many other countries have, we wanted to be ready, and we still must be ready. But I do think your point of now looking at, you know, can we start to look at elective surgeries? Can we start to open up some hospitals? And can we start to get back in business? Because it's still a concern. People home who have an illness, who feel uncomfortable coming to the hospital, or they have been postponed their surgery. So as part of the recovery plan, it's not all about economics. It's about restoring our healthcare system back to its original self and better. As we have learned through this process, but it's very much a focus for us to get back into the healthcare business over and above COVID.
Dr. Russell's coming to the podium, Gail.
Thank you.
Yeah, so we definitely wanted to be prepared for the worst case scenario. As we'd seen in other jurisdictions, when they quickly became overwhelmed, it was too late to act then. So we wanted to be extremely proactive and make those hard decisions. As difficult as they were, those were not easy decisions to make, and we worked very closely with the regional health authorities on that to really identify what was the bare minimum that we would need to continue functioning within the hospital, knowing that, again, if we had an increase in numbers very suddenly, that we would need a lot of space in the hospital system, and we needed to protect people who didn't already have COVID-19 from being exposed. So part of the recovery plan that we have in terms of the next phases of the response, we will make sure that, again, the triggers are being discussed at the national level in terms of when to release measures, and the triggers of when to put measures back in place are being developed at the national level, and we are incorporating that into our provincial approach. So we will make sure that we have those conversations and make sure that we get things up and running as soon as we can, with all of those pieces of information in mind, knowing that, again, this will be a cyclical event whereby, again, because we can't change what's happening outside of our borders, our neighbors are still struggling with their numbers and probably will continue to struggle for a while. So as long as we are bordering on neighboring jurisdictions that have case counts that are increasing, we have to stay vigilant, and we have to be prepared for releasing measures and then imposing them again on very short notice. So we are going to be doing a dance, basically, where we lift measures and we put them back in place based on data and based on criteria that is being established at the national level around case counts and the types of cases that we see in a province and the time frame around when we stop seeing an increase in numbers.
Gail, do you have a follow-up today?
Yes, and this can be answered either by the Premier or Dr. Russell. There will be a lot of surgeries that are going to have to be rescheduled. Does the government have a plan to avoid a logjam of those?
Today, we're working with the Department of Health, working with the medical societies as we put together a schedule, understanding, what is the backlog. I guess what I'm hopeful, we've seen a lot of great changes in the system, I guess, in ways of getting things done that would have taken weeks and months and even years that have been accomplished in the last five weeks. So I am encouraged by that and optimistic that we could see that same sort of efficiency and improvements and reaction to getting back up and running as we can, based on what we can work through with public health as a safe and way to return to service, but do it in a way that is maybe certainly more proactive and can be accomplished in a much faster pace as we've seen. I think the last thing that we want to do is just simply, you know, have the hospitals fill back up and people wait for surgery. Let's try to make that so we can schedule it in advance. We can have people moving through the system. I know we're looking at it in other areas. The court system changes that have been made, in doctor's appointment changes have been made. So can we have a better scheduling opportunity and be proactive in how we manage to get people in and out of hospital for their surgeries as quickly as possible?
Michel Corriveau, Radio-Canada.
Oui, bonjour, merci Bruce. J'ai une question pour Dr. Russell. J'aimerais savoir, Dr. Russell, si vos prévisions que vous avez partagées il y a plus d'une semaine maintenant, là, de 500 à 1700 cas au Nouveau-Brunswick, est-ce qu'elles sont revues à la baisse à la suite de la dernière semaine où il n'y a presque pas de cas?
Le nombre 500 jusqu'à 1750, ça c'était le nombre de décès qu'on pourrait voir aux prochaines 2 ans pour le temps total du pandémie.
Michel, as-tu une suivi ou clarification?
Ben, peut-être une clarification. J'avais une autre question, mais donc c'est pas revu à la baisse. C'est ça que vous nous dites. Hein?
Peux-tu clarifier ta première question, s'il vous plaît?
OK. C'est juste, je demande si les prévisions qui ont été faites sont revues à la baisse. Est-ce que vous prévoyez maintenant qu'il y aura moins de cas et moins de décès?
Ça, c'est pas facile à prévenir parce que les endroits hors du Nouveau-Brunswick continuent à avoir des cas et des nombres de cas qui augmentent. Alors, ça veut dire que n'importe qui voyage en hors du Nouveau-Brunswick a le risque de l'apporter un cas de COVID-19 ici à la province, aux provinces. Alors, au fur et à mesure que des cas vont rentrer, puis s'ils ne sont pas complètement isolés, ça veut dire que les gens de Nouveau-Brunswick continueront à avoir le risque d'avoir des cas augmentés soudainement à n'importe quel temps. Alors, pendant les prochaines 18 mois à 24 mois avant qu'il y aura un vaccin, c'est comme ça qu'on va vivre ici à Nouveau-Brunswick. Quand les nombres sont bas, on peut changer les mesures qui sont en place et au fur et à mesure que les nombres de cas augmenteraient, on va replacer les mesures qui sont en place maintenant de nouveau. Au fur et à mesure qu'on a besoin d'identifier tous les critères au niveau national qu'on va baser nos décisions dessus. Et c'est-à-dire, c'est l'épidémiologie qui va nous dicter quand et comment qu'on va changer les mesures.
Merci. M. Corriveau, as-tu un suivi?
Oui, j'avais une question pour peut-être plus le premier ministre, M. Higgs. Il y a une possibilité qu'il y ait des mesures moins sévères à partir du mois de mai. Vous l'avez rappelé encore tout à l'heure. Si des entreprises qui sont maintenant fermées devaient ouvrir, est-ce qu'il va y avoir des changements au niveau des garderies pour permettre aux travailleurs de retourner au travail? Comment ça va se faire?
So, very good question, and certainly we would be coordinating that as a requirement prior to making the moves and what businesses would open, because we recognize that many families right now are at home, and if the family members were back to work, then there could be a need for additional childcare spaces. So that'll be part of the consideration as we look across society, as we look across the province, and in what areas of startup, then what are the individual considerations, and do we have the requirements? So it is part of the analysis of how we start up.
Thank you. See. Silas Brown, Global TV.
Hi, Premier. I know that you alluded to the tight bond between Nova Scotia and New Brunswick in your opening remarks, but I'm wondering what you have to say to New Brunswickers who have been impacted by this tragedy that happened yesterday, who are unable to cross the border to see their loved ones and offer their condolences, or even spend time with their loved ones within the province. What do you have to say to those people?
Well, it's a devastating tragedy that's been made even worse by this health concerns that we have now in our respective provinces. So I know that it's tough, and I just ask that people respect the health rules that we have in place for our own protection, but reach out to their family and friends in whether they be in New Brunswick or they be in Nova Scotia. Reach out in other ways, and we can certainly do that online. We can have the interconnections without the physical connections. But it is really tough, but it has to be handled in a different way, because we can't lose sight of why we have these public health measures in place, and we can't lose sight of the emotion and the tragedy that affects every one of us, whether it happened in Nova Scotia or whether it happened elsewhere. This is an immeasurable loss in our respective community and in our province, a neighboring province in this case. And we all are devastated by it.
Thank you. Silas, do you have a follow-up today?
Yes, one for Dr. Russell. You spoke about the potentially cyclical nature of easing and then re-implementing restrictions. What would be some of the triggers for that? And would, as you kind of ease and implement restrictions, would that be based, regionally if there were flare-ups or that sort of thing, or would things still kind of be cross-country? Maybe this is also one for the Premier as well.
So at the national level, through the Special Advisory Committee, which is made up of the Chief Medical Officers of Health from across the country, as well as the Chief Public Health Officer and Deputy Chief Public Health Officer for the country, the criteria in terms of the data that we will use is going to be consistent across the country, but how each province applies it will depend on their individual data and their individual number of cases, et cetera, and the type of transmission. So if you break it down into jurisdictions, then within each jurisdiction, if we need to make changes according to areas that need different types of measures applied, we can definitely have those conversations. I think right now we're trying to nail down a consistent framework so that we are all singing from the same songbook. And that way, when we do apply those measures individually in each province, then we can have our own discussions around what that looks like at a provincial level and then at a regional level.
Thank you. Laura Brown, CTV.
Good afternoon, everyone. Premier, I'm wondering if you could tell us whether or not the border closure would be one of the last restrictions or measures to be lifted, like in the sense of off to the lower end of things with the borders be the last thing to kind of open up?
I would say at this time, yes, indeed. Certainly, if we see the level of concern and the health risks around us, it would not be prudent for us to change the regulations around our borders. However, we'll work with public health to come up with the right solution there, but I would say, yes, indeed, it would be one of the last things that would change.
Thank you. Laura, do you have a follow-up this afternoon?
Yeah, and on that, so is there going to be other plans in place for the tourism sector here in the province? Are you going to be encouraging, I guess, more New Brunswickers to help tourism operators in this time when they can't count on out-of-province visitors?
Yes, indeed. I think that in this situation, this is a time to discover New Brunswick once again. So once we are able to, and hopefully that will be soon, to allow more movement throughout the province, we want to have people be staying in New Brunswick. And I guess we've heard the term many times about a staycation, where we have our own people traveling throughout New Brunswick and not traveling outside. Because at this stage, any outside travel would require a quarantine coming back into the province. And we'll look at that, or self-isolation. We'll look at that as time goes on, but But I would say people should be looking at New Brunswick once again.
Thank you, Laura. Matthew Wacomo, l'Acadie Nouvelle.
Bonjour, ma question est pour Dr. Russell. Sachant là, qu'il y a de plus en plus de journées sans nouveaux cas et ça fait à peu près une semaine qu'on a étendu les critères pour le dépistage, est-ce qu'on est encore loin du moment où on commencera à tester même ceux qui n'ont pas de symptômes, commencer à tester les gens qui sont asymptomatiques pour vraiment voir s'il y a de la COVID-19 dans la province? Est-ce qu'on est loin du moment où on va faire ça?
Non, on n'est pas loin, mais si on le fait, ça va être quelque chose qui va être pour des populations spécifiques qui sont à plus haut risque. Alors, ça, c'est des discussions qu'on est en train d'avoir maintenant. Alors, les planifications vont suivre nos discussions et ça va arriver, j'espère que ça ne sera pas si longtemps d'ici.
Merci Bruce, pouvez-vous clarifier quelles seraient ces populations à risque et aussi nous dire, si vous avez l'information, comment ça se passe du côté de télésoins en ce moment, s'il y a encore beaucoup d'appels?
Alors maintenant, moi j'ai entendu le rapport de 811 ce matin, puis le volume d'appels est encore là. Le pourcentage des gens qui sont référés pour des tests a augmenté à cause de le changement dans les critères. Alors, je crois qu'ils ont reçu peut-être 200 appels, puis de 200 appels, ils ont envoyé presque la majorité pour faire les dépistages, à les centres de dépistage. Alors ça, c'est la première partie du question. Au sujet des populations vulnérables, on a un groupe de travail qui a identifié tous les groupes vulnérables et on a des directives, des documents, des différentes parties de travail sur ce sujet pour faire sûr que tous les risques qui sont identifiés avec les populations vulnérables sont adressés. Et s'il y a plus de travail qu'il faut faire avec ces populations, on a la capacité de le faire. Alors, dans ce groupe de populations vulnérables, c'est à cause de les risques augmentés que si on allait commencer à tester des gens qui n'ont pas des symptômes, ça serait fait partie de ce groupe vulnérable. Alors ça veut dire des gens qui sont à des foyers de soins, des gens qui sont dans des qui n'ont pas de place à vivre, alors des shelters. Aussi des gens qui sont peut-être en prison, aussi des gens qui sont en plus haut risque à avoir le COVID-19 et si l'on contracterait, ça serait plus à risque à la population qui demeure avec eux.
Merci. Mathieu, tu as suivi, n'est-ce pas?
Oui.
Merci. Charles Caméran, TVA Edmundston.
Oui, merci Bruce. Ma question s'adresse au Premier ministre Blaine Higgs. Dans la dernière version de la déclaration là, concernant la prolongation de l'état d'urgence jusqu'au 30 avril, vous stipulez comme quoi il est interdit aux propriétaires et aux exploitants d'admettre des clients, mis à part s'il y a une interaction minimale de 2 mètres qui est respectée. Vous avez mis une liste d'exemples de propriétaires et exploitants. Prenons l'exemple des toiletteurs pour animaux. Si jamais, exemple, le client emmène l'animal en question à l'entrée du commerce de toilettage, est-ce que ce commerce en question-là pourrait, exemple, réouvrir prochainement? Comment ça fonctionne pour cette situation-ci en particulier?
So going forward over the coming days and weeks, we're going to be looking at specific cases of being able to open up, and I mean that would be one case. What would that entail? And if that operation can verify and validate that they can provide a safe operation that respects social distancing, then our goal would be that we would allow them to start up operations. But I think that what we want to do is basically identify different businesses, but more so identify the requirements to return to operation. And then the onus is on the individual operator to meet the guidelines, and they will be monitored and enforced, but that they would come up with a procedure that could be approved that say, here's how I can run my business and meet the public health requirements. And we'll be providing, you know, that sort of, I guess, path forward in the coming weeks and months, or days and weeks, I should say. And the idea is that we want to be sure that the onus is on the individual to meet the standards, because the options in not doing so would be a fine or certainly a closure or shutdown. We just cannot allow any option, I guess, to loosen our current situation that would be to our detriment, and we see an increase of cases, because it can start so quickly if we don't all continue to exercise good behavior.
Thank you. Monsieur Cameron, as-tu suivi cet après-midi?
Oui, merci Bruce. Mon suivi s'adresse encore une fois au Premier ministre Blaine Higgs. La semaine dernière, M. Higgs, vous n'aviez pas fermé la porte à une possibilité de peut-être ouvrir une augmentation de salaire pour ce qui est des travailleurs, pour certains d'autres travailleurs à services essentiels. Ma question est la suivante. Est-ce que vous avez pris une décision concernant peut-être une possible augmentation de salaire pour les travailleurs qui évoluent dans les foyers de soins de la province? Est-ce que vous avez pris une décision au moment où on se parle, ou vous y pensez encore?
Well, it isn't necessarily a simple case of me thinking about it. It's a case of understanding what are the rules around what the federal government had put in place. So at this stage, we are trying to determine exactly what's the criteria. But what criteria that they have given us is not so much in the definition of the essential workers, because we can all have different definitions, and we certainly know that the healthcare workers and the whether it be in the nursing homes or the hospitals or special care homes or any type, as well as truck drivers, as well as many others, would be essential services. What the federal government has proposed is that their consideration is for anyone earning less than $2,500 a month. So what we're doing is we're trying to get clarification on their definition of an essential worker, and also we're looking across the spectrum to see how many essential workers that we will determine would qualify for their compensation.
Merci, thank you. Merci, Monsieur Cameron. Jacques Poitras, CBC.
Hi, Premier. You've said that the surplus is gone for this year. On Friday, David Coons said that he thinks there needs to be this higher level of spending for the long term to support workers and businesses. How willing are you to look at a deficit for a second year, and what will it look like to get out of the deficit?
Well, firstly, I don't think we can make any let's say a statement that we should look at a higher level of expenditure. It should be, what is that expenditure going to achieve in relation to what it means for the long haul for New Brunswick citizens? So in other words, are we going to be able to fund the absolute necessary services? Are citizens of the province, are they ultimately, would they be satisfied with paying more taxes? If we have a reduction in our transfer payments, and one would certainly be concerned about that, given the fact that the major sources, some of the major sources of revenue into the federal government have essentially dried up. And so what does that mean for the long haul? So I think this has to be a very balanced approach, and I'm eager to entertain that discussion with not only the leader of the Green Party, but the leader of the Liberal Party and the leader of the People's Alliance on about the long haul strategy. Because any decision we make is about the long haul. So, you know, it's like, are we in a process here of recovery, or are we going to just simply put the Band-Aid on for today and not worry about tomorrow? And I think that anyone who knows me by now would recognize that I don't like making decisions for just today. I like to make a decision that's based on how we see the future of our citizens continue to prosper and move back to a new norm, as we've talked about, but do it in a way that is sustainable and they can find employment and that we can find a path forward over the coming years. And that'll be my goal, and I'm sure Mr. Kuhn would want to look beyond just today and look for tomorrow as well.
Thank you, Premier. Jacques, would you have a follow-up today?
Yes, thank you. You and Mr. Kuhn have both also talked about New Brunswick being exposed to disruptions in the global supply chain, how that's become evident. You know, trade is a two-way street, and if we pull back from importing as much, I wonder what will happen in terms of reciprocal agreements to our ability to export our products.
Well, that's absolutely right. It is a concern in both ways. So how do we look at sectors? And we had this discussion last week about food security. And if we can ramp up our ability, let's say, to grow more here in the province and have a greater level of food security, then let's start down that path. Because, you know, of the old adage, you just don't, you know, cut your nose off, spite your face, so to speak. You know, when you absolutely need to know where you're going and you build up that capability before you find out I don't have a backup. So today, and I know we had a very good discussion on food security, and we're all in agreement that, you know, one thing we have here in this province is we have many things, but one thing is certainly lots of land, and we need to make better use of it. So we can start to reduce our dependence, but it's, again, not something that you can do overnight. It's something that you build some clear line targets. And for me, as part of, I guess, what I've said a few times here, part of our ability right now that is unique is we have got, you know, working our way through a health crisis, and we're working in a way through this in nonpartisan fashion. And that's exciting. We need to build our economic recovery in the same nonpartisan fashion, so it will continue to get better year over year, and it won't be dependent on the election cycle.
Thank you, Premier. Thank you, Jacques. Did I miss anybody this afternoon?